author of the blog hospitalonlinemarketing.com. As I work with more and more hospitals and physician practices these days and helping them extend their marketing and communication strategies online, it becomes very clear that hospitals and physicians need to begin understanding how patients are thinking when they're actually going online to research their healthcare. And it really is a simple linear path. It's actually a path that I call the typical online healthcare decision path. The first step of this path is when patients are actually presented with a symptom or a condition or even a disease. And what they do is they turn online to actually look for answers to the questions of what's wrong with me? How can I treat this? Why won't it go away? I twisted my ankle. Why isn't the swelling going down? This rash I developed is just not going away. What can I do? This is when consumers go to sites like Google to type in their questions, or maybe even they go to sites like Wrong Diagnosis or WebMD or even Wikipedia to help them understand their disease or their symptom or their condition. The second step of this path is when they begin researching their physicians online. Now, you may say, well, many consumers have a relationship with a primary care physician right as it is. Well, this isn't necessarily true. With the change in jobs, maybe they've moved to a new area, or maybe their insurance has changed and they're not sure if their physician is covered by their insurance. This is one of the questions they look for when they go researching online. But they also look for other questions like, should I see a primary care doctor or should I see a specialist? Or what are other people really saying about this doctor? This is when consumers go to sites that have ratings about physicians. That could be like Rate My MD or Yelp or even Angie's List. Now, after they research their physician and they actually make that appointment with that physician, what they do is when they show up in the office after printing out a stack of paperwork that they got off the internet and they say to the doctor, well, I've already diagnosed myself, can I have a second opinion? And the doctor then says, well, let's actually look at what your problem is, and they make a diagnosis and they make a suggestion for a type of treatment. And they may say, you need to take this medication, or you may need to go to this rehabilitation, or you may need to just take 2 aspirin and call me in the morning. Well, what happens is the patient in this day and age goes home from that doctor's visit and goes to the third step on the path, which is where they begin researching their treatment. Now, yeah, they are second-guessing the doctor. They're actually looking to see, is this the right medication for me? Should I get a second opinion? Should I go see someone else to get a second opinion? Or is there another type of treatment that I should follow? If the healthcare problem then persists, the consumer then follows along to the fourth step, which is they research a provider. The doctor may say to them, your ankle may be a torn ligament. We need to go in. You need to go see it. We need to go do some treatment, or we need to do a laparoscopic procedure, or we need to do a skin graft. Then at that point in time, the physician may say, we could do it here in my office, or we could do it at the local hospital. And what happens is that patient goes online then to research the provider. Now, this is the step where they actually are researching the best place to get their health care. This is when they go to sites like Healthgrades or others to really research the quality of that provider. They're looking for things like answers to questions like, do I need to go to a hospital to get this done? Does it have to be a surgical procedure? Is there an outpatient clinic I can go to? Where is the best place in my area to go? Which hospital should I go to? Now, after they go through and research the provider and they get their treatment done, they follow the path to the very last step. And that last step on the path is where they're actually researching their recovery from that treatment, from that procedure. What they're looking for then is answers to the questions of, how long will it take for me to recover? Are there any support groups? Has anyone else undergone this? What can I expect? Now, it's important to understand the entire paradigm of the typical online healthcare decision path to help put your hospital or your physician practice's online marketing techniques in the right place at the right time. As I always say to my clients, how far up this decision path do you want to extend your online marketing? Now, I hope this has been helpful. For more information, you can visit us online at www.hospitalonlinemarketing.com, or you can view our video series on YouTube, or even check us out on iTunes. Just search for Hospital Online Marketing. I'm Chris Boyer, Online Marketing Specialist, and I'll see you next time.